Well, good morning and welcome everyone to Administrator Issues and Updates on July 14th, 2026. County Administrator Gary Schmidt, will you please call the roll?
Yes, thank you, Chair. Good morning. Roll call. Commissioner Savas.
Present.
Commissioner Helm.
Here.
Chair Roberts.
Here. All right. You want to introduce our first agenda item, Gary?
Yes, and Commissioners West and Schrader are here. They're delayed. They'll be here in a moment. The first item today for issues is comment letter for Middle Housing, Oregon Homes, Phase 1 rulemaking. There's a draft memo. There's a memo and a draft letter in your packet. Presenting is Cheryl Bell, Assistant Director of Transportation and Development, and Jennifer Hughes, who's the Planning Division Program Director. Go ahead, please.
Hi.
Good morning, Chair Roberts and Commissioners. We're here today to discuss an important opportunity to provide comments to the Land Conservation and Development Commission as they consider adopting new rules around housing. We are bringing this to you as we believe it's an important to provide comment as it's in alignment with your board goal of streamlining development regulations. So the Land Conservation and Development Commission, or LCDC, is holding a public hearing on July 29 to consider proposed rules developed in response to two House bills, House Bill 2138 and House Bill 2258. This rulemaking effort is officially known as the Middle Housing Oregon Homes Rulemaking, or MORE Homes. You'll see that acronym a lot of places. And it creates a new land use process for a subset of lots that meet certain criteria. So if a lot's within the urban growth boundary, it's zoned for residential, it's between 1,500 and 20,000 square feet, it's vacant and meets other criteria regarding slopes and environmentally sensitive areas, a developer can use the MORE Homes process to override existing local zoning and development rules and significantly reduce setbacks and increase density. So staff have been involved in this rulemaking process as part of the committee, and throughout the process we've been concerned as the draft rules circumvent local zoning and siting standards and will increase administrative burdens. While these concerns have been raised during the rulemaking advisory committee discussions, the draft rules didn't recognize these comments. So I'm going to pass it to Jennifer, and she's going to talk more specifics about what we're concerned about, what we outlined in our memo.
All right. Hi.
Good morning. Again, Jennifer Hughes, the Planning Director. As Cheryl said, we have a lot of concerns about these proposed rules, and I think as we've talked to the board about previously, it breaks down into really kind of two separate issues. One is this continued erosion of local control in terms of our zoning regulations in our residential areas inside the urban growth boundary. And this is just another layer. We're gonna do more, right? We started with middle housing, and then the middle housing rules have been changed and changed again, and now we're adding something new that will allow up to 11 unit apartment buildings in what was historically single family zoning. And essentially it's a supersiding. They meet the standards, we have to allow it. Reduced setbacks, no building height limit, no parking requirements, as you know, in the urban area, and no local say in terms of what the standards are. This bill does provide for that, the bill that the rulemaking is based on, but the bill was optional, so DLCD really didn't have to do this, but they did choose to do this, or at least we think they're going to choose to do this. They haven't officially adopted it yet. And then the second piece, besides the erosion of local zoning control, is just the administrative burden that it places on the county. Although there is a lot of lip service paid to the idea that we're going to make things easier for developers, easier to get housing on the ground, by layering these regulations and layering different review procedures, they really are creating a lot of conflicts, a lot of confusion, and every local government has to sort that out. And so it does not become easier for us, it becomes harder. Yeah. And we're happy to answer questions.
Yes. Right. Yeah, we just think it's important to provide comment and have our voices heard. And I do think it's really important to note that the jurisdictional partners on the Rulemaking Advisory Committee, many of them, based off of comments at last Thursday's meeting, will also be submitting similar comment letters because we've all been voicing concerns throughout the entire process and they really weren't reflected in these final rules. So we respectfully recommend that we send this letter to the Land Conservation and Development Commission.
All right. Commissioner Helm has a question.
You just sort of answered my question. But I appreciate the letter, and I can't stress how important it is for us to have local control. And I met with a state representative the other day, and I told him that every time they go to try to help us here at the county or at the city level, they're layering on more and more bureaucracy, and it just slows down the whole process. And it came as a surprise to them that they're trying to help actually makes things worse. So I said, when you go to the legislature next January, February, please don't make any more new rules. But you were really nice, and I was sorry, you were so polite. I'm just like, you having the voice of some of the other counties and stuff helps, but I mean, is it strong enough? They seem to be ignoring us, obviously.
I mean, I think we feel like, we don't feel optimistic that this will make a difference.
Oh.
I think that's, I think we do need to say something. I think
Yeah.
we all need to continue to say
Yeah.
things. But I would say that the past few years have not really demonstrated that they're listening.
We provided pretty clear comments throughout the whole rulemaking advisory process for multiple jurisdictions, and there's been a lot of coordination with LOC and AOC. And as Jennifer said, we think this may be on rails.
And other counties are on board too. I mean, this is obviously, it's hitting everybody. Yeah.
Yeah, there's definitely concerns. We're talking about it at our Association of Oregon County Planning Directors meeting next week. I think you will see a lot of other comments from local governments, yes.
All right. Thank you.
Great. Commissioner Savas.
Yeah, I kind of agree. One of two things, it could be a little bit stronger and/or is there, maybe you've already said it, so I'm a little bit distracted right now, but, so I apologize if you already mentioned this. Is it possible we can get some other counties or AOC to join us in a communication? And I think that will, even with the same language, would be a lot stronger message.
I mean, AOC and LOC both had representatives on the rack. I think that they will be probably submitting comment.
Yeah, from the comments made last Thursday, it sounds like other jurisdictions are submitting their own letters. There hasn't been an effort from AOC to do a joint letter. I can reach out to them, but I think based on the comments of the representatives on the rulemaking committee, they were all going to be doing similar approaches with bringing letters to their elected officials and asking to send separate letters.
All right.
Staff are also submitting technical comments in addition to the letter, just based off of technical issues with the rulemaking.
All right, if there's no other questions, is there a motion regarding the letter?
I move to approve the comment letter as presented.
Second.
All right, Commissioner Helm has moved to approve the comment letter as presented. Commissioner Schrader has seconded that motion. Any further discussion? Seeing none, clerk, will you please call the poll for us?
Commissioner West.
Aye.
Commissioner Helm.
Aye.
Commissioner Schrader.
Aye.
Commissioner Savas.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you both.
Thank you very much.
Very informative, great. Gary, what's next?
Thank you. Next, you have several items related to the Recovery Campus that we'll do one at a time, but we'll start with Recovery Campus, Fora Health Construction Phase Amendment. Presenting is Mary Rumbaugh, Director of Health, Housing, and Human Services, and Cindy Becker, Project Manager in the Office of the County Administrator. Go ahead, please.
Good morning, Commissioners. Cindy Becker, County Administration. Before we go into this, there's a couple of comments I want to make. Doing these documents, these contracts and these leases are not the kind of fun, sexy, glamorous part of this project, but there's a lot of people who put an incredible amount of work into this, and I just would like to acknowledge the work and their effort and the time they spent. And obviously, Mary and her team, Rebecca and Angela, and two of our Billy's staff, County Counsel, Andrew Naylor and Amanda Keller, and Trish from Risk Management. This was really, it was a joint effort, and it was a lot, and it was detailed, and they don't, they're not going to be at the groundbreaking getting all these kudos, but I do want to extend kudos for all their work on this. It was really an incredible job. So with that, are we doing Gary, the lease or the contract first?
The Construction Phase Amendment contract first, please.
Okay. So, Commissioners, this amendment is adding $23.29 million to the existing contract we have with Fora Health. As you recall, you approved a contract months ago for the design and the development, and this part of this amendment is to add the dollars for demolition of the existing structure and construction of the actual recovery campus. One of the things that you'll say, well, wow, that's not what we thought. It was a lot less money. And the reason is, after talking with council, we don't want to put in dollars that we haven't received yet. So once we receive the dollars for the, we know we received the dollars for the Oregon Health Authority amendment. There's $5 million coming from lottery dollars. There's $2.5 million coming from the federal earmark, and then there's our loan. And once we have those, we will come back to you to amend this contract. So, and there's provisions and there's language around this about, Fora understands that this is what we have, and we will amend it as soon as we get the other dollars. So the project is not costing $23 million. It is about $39 million plus the property, which is still a little over $1 million less than we had initially budgeted. The nice thing about this contract amendment and the pricing is, and I know that Commissioner Savas has been concerned about this in the past. We actually said, here's the money we have. We didn't start with the design, we started with the money. And basically said, here's the money we have, what can you design for this money? And so we really looked at controlling the narrative, if you will, from the beginning. So we didn't have designs that we couldn't afford and having all of the consternation around that. So I feel really confident the team, the Fora team with Walsh Construction and with Edlin and Holst, they really worked hard to make sure that we got the best value and the best materials and the best everything for the money. They were very cognizant of the dollars. They really came in looking at how they can not only meet the budget, but if they can do better than the budget. So I'm very proud of working with them and the work they've put into this. We've insured everything back and forth between the county and Fora Health. The only thing we haven't insured for is Aliens Landing. But other than that, there's double coverage in some areas. Fora is paying for the insurance. So I think, excuse me, that's part of the lease. But I think we have done a really good job of, our lawyers have done a really good job in making sure the county is well positioned and Fora lawyers as well. So I'm proud of this contract, and I'll be happy to answer any questions.
All right, any questions? Got some? Go ahead, Commissioner.
Great job. This is exciting. I can't believe we are here talking about the contract. I'm going to support this recommendation today. It looks great. I know you guys have done an immense amount of work, and I remember when we didn't know if this was going to be possible, and we just kept believing in it and working towards it, but we were able to make it happen. And so it was not always as assured as it is today in the last few years, but we never gave up and we kept driving it and we got there. And a lot of people, a long, long list of people are to be thanked for this. And I think it's going to be very exciting for the whole region. And I love how we're leading in this space. So Cindy and Mary, thank you so much for your leadership. It's going to help a lot of people. Thank you.
Great. Commissioner Savas.
Yeah, I'd like to ask legal counsel a question. I see Andrew in the back, just so I hear it from legal counsel themselves. Not that I doubt any of our great staff in front of us. This is in regards to the legalese, if you will, of the agreement. So my question, under indemnification and all of that, but more specifically, insurance, they will cover their own insurance for their operations at this facility?
Andrew Naylor, Assistant County Counsel. That is correct, Commissioner. So in the grant amendment, it adds some insurance requirements for builder's risk during construction. So that will protect Fora as the project develops in case anything happens during construction. In the lease, which we'll get to in a little bit, they are providing property insurance and general liability insurance. And in the original grant, going way back when, they have other insurance requirements. So they are well insured both for construction and then operation when they get to that point.
Okay, and then further to clarify, the project manager is who?
Fora's project manager?
No, to build the building, who's the project manager?
Welsh Construction.
No.
What, I'm
That's a
sorry.
construction company.
That's the construction company. Who's the
Fora.
project manager? Who's
Fora Health.
That's
Yes.
okay. That's what I'm asking. Thank
I
you.
asked that already, too.
All right. Any other questions?
One quick thing,
ahead.
when you see this is the final draft, we are tweaking a couple of non-substantive words, literally here and there, and it's just the very last piece. So the final document may have, like we switched a word in one of the terms, but there's nothing substantive at all. So I just wanted to let you know that we needed to make sure that we got this to you because we are still doing groundbreaking July 29th, and we thought it'd be really good if they had a contract before then. So
Yeah.
we're bringing this back to you. This will be at the July 23rd business meeting. You will have the document in 2 days if there's any, as I said, those couple of tweaks.
I'm curious what the substantive words are, because in lawyer world, it is, the difference between should and shall are really, really big words.
Well, we are joined at the hip with county
Okay,
council.
okay.
Joined at the hip.
All right.
Yes.
All right, good, thank you.
Versus May.
Yeah, versus may, yes, exactly, okay.
Nothing like that.
Okay.
It is literally things like we had to change the date to make the insurance requirements match.
Okay.
It's just a last minute cleanup. There was some typos. There was some pagination issues that we fixed. So the core terms haven't changed. Is what you're looking at today.
Fantastic. So if there's no objection, this is going to be advanced to our business meeting on July 23rd for final approval. So yes, great job, you two. And Gary, what's next?
Thank you. Next, still on the Recovery Campus, this is the Fora Health property lease. Cindy and Mary, go ahead, please.
Thank you. So you'll notice that the actual property lease is longer than the contract amendment. And the terms are, there's a 20-year term, July 2026 through July 2046, and there is an option to extend for another 20-year term. Fora will make a one-time payment of $20 for rent, so it's $1 a year. And the county, after the first 20 years, has discretion to increase the rent. But I'm assuming that won't happen, but we're good. And so, as we mentioned, the net lease, Fora is responsible for all costs and expenses, including insurance, maintenance, property, all of preventive maintenance, et cetera. The lease, they will be demolishing the existing improvements of the existing building and constructing the campus. They are also going to maintain the property, so not just custodial, but maintenance. And then we are going to do a separate agreement on the maintenance, just that will be a contract with H3S for the maintenance functions. But it is cited in here that that's their responsibility. And other than that, it's pretty much it. Again, I think the county is well protected in this lease, as is Fora.
All right. Any questions?
Just the same question, and I think you already said it, but in regards to the lease, they will insure their operations on their own dime, correct?
That's correct. They have property insurance on the building, and then they have CGL coverage and professional liability for operations.
Okay, thank you.
I just had one suggestion. We might frame that $20 bill, so.
Well, they won't be giving it to us in pennies because they're not around anymore. So.
That's right.
All right, so there's no objection. This advanced to our business meeting on, again, July 23rd for final. So thank you very much. Gary, notes?
Thank you. Still on the Recovery Campus. Next is street lighting request. Go ahead, please, Cindy and Mary.
So, Commissioners, I have to be honest with you. I don't have a lot of the technical knowledge about this. This is something that is required to do. So it requires your approval to move forward with this. And I did notice there's a cost. If you look at the paragraph under annexation and assessment, essentially the street lighting is required by ZDO section blah, 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 for all development within the urban growth boundary. So based on the submitted land use proposal, this will be required, new street lighting will be required on Tolbert frontage in front of the property. The amount of money in terms of the dollar impact, we're looking at anywhere between $500 to $1,000 in a year. So it's pretty minimal. So we're requesting that you approve this.
Questions?
Please don't ask me any questions.
I move to approve the street lighting request form as presented.
Second.
All right. Commissioner Helmus moved to approve the street lighting request form as presented. Commissioner Schrader is second. Any further discussion? Seeing none, clerk, you please call the poll.
Commissioner Savis.
Aye.
Commissioner Schrader.
Aye.
Commissioner West.
Aye.
Commissioner Helm.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
All right, thank you. It's still up?
All right,
Jerry?
one more. You're booking through this. Last item is Recovery Campus naming of the facility, Part 2. We're back to you again on this. Cindy and Mary, go ahead, please.
Mary's taking this one.
I'm taking this one. Good morning, Chair Roberts and Commissioners. Mary Brumba, Health, Housing, and Human Services Director. So we are back here today, hopefully to finalize the name for the new Recovery Campus. During the June 16th policy session, we did propose names that have been reviewed by both our internal Recovery Campus Task Force group as well as our external Recovery Campus Task Group made up of many community partners. At the June session, the board requested more time to review both the options initially proposed as well as to consider other names. And as noted in your board memo and is up on the screen, the following names have been proposed. Clackamas County Recovery Campus, which is actually how we refer to the project currently, Clackamas Treatment and Recovery Campus, Clackamas County Center for Treatment and Recovery, Clackamas County Recovery and Wellness Campus, or Recovery Campus of Clackamas County. We are not really coming forth with a name recommendation. Really, our ask is that the board decide, if they can, decide a name in time for the July 29th groundbreaking. So we would open it up for any questions.
All right, Commissioner Helm.
Well, I don't, this hasn't changed since our last meeting, but I don't disagree with For Health's option, but I would recommend Clackamas County Treatment and Recovery Campus, so that it has the word county in it, just versus the word
Yes.
Clackamas. CCTRC, right? That would be my recommendation. And it kind of goes along with what they're recommending, sort of.
Okay. Commissioner West.
I'm not opposed to the word treatment. It gets long. Thought about this a lot. It's all kind of governmentally generic, but
We are treating.
But we are treating, but that happens within recovery broadly. I do kind of, not that maybe it was always the best thing since the beginning, we've always been calling it, there was the Clackamas County Recovery Campus, CCRC. I'm not opposed to the word treatment, I just think it gets a little unnecessarily long. It's, as I thought about trying to get creative with it, nothing was quite landing as I played with it. Played with the word Mount Hood or, all these different things. But it does tell people exactly what it is clearly. I don't know, I support either one, but I'm more partial towards Clackamas County Recovery Campus.
Commissioner Savis.
Yeah, I echo that. I primarily because the campus is what it is today, but tomorrow the campus will be bigger. I don't mean tomorrow, but in the future. So because a lot of that will be Clackamas County, I think it's a good idea to include county in there. This is only part of the land that's available that we're currently working on.
What do you think?
Ms. Schrader, where do you land there?
Either one, really. Clackamas County Recovery Campus is like CCRC, gives it a nice acronym. But it is a treatment center, so I think we should, I like Clackamas County Recovery Campus. I think it kind of just lays it out pretty clearly of the two. But I can go for either one. And it does said For Health prefers the second option. Is that what we're?
They do, but ultimately,
It's up to us, yeah.
it is up to you all.
Do we know why they prefer that one? They just think it's a little more explanatory?
No, I didn't, no. I didn't ask.
It just gets long.
Yeah, it gets long, yeah,
It is long.
yeah.
Can I make a motion?
Sure.
Chair, I move that the name for the recovery campus to be the Clackamas County Recovery Campus.
Second.
All Right. Commissioner West has moved to name the Recovery Campus as Clackamas County Recovery Campus, and Commissioner Helm has seconded that. Any further discussion? Clerk, please call the poll.
Commissioner Schrader.
Aye.
Commissioner Savis.
Aye.
Commissioner Helm.
Aye.
Commissioner West.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
All right, so it looks like it's CCRC then, huh? All right, Gary, what's next?
Congratulations. Thank you, commissioners. Thank you, Cindy and Mary. Thank both of you
Thank you.
for your leadership and work. That is all for the Recovery Campus for today. A quick addition to your agenda. As you know, there is no business meeting for you this Thursday, July 16th, because several of you will be at the National Association of Counties Conference, and others of you have some planned time away, so there's no quorum. The next business meeting there's also no issues next Tuesday for the same reason. You will next meet as a board Thursday, July 23rd after today. The last item today on issues is Commissioner Communications.
All right. Commissioner Schrader.
Well, I am heading out to go to the National Association of Counties Conference. I'm curious to see, there's going to be some changes at the national level, particularly at the executive board. And so we will have a voice in making that happen and voting. I also just want to thank folks for holding down the fort. While I was gone, I had a death in the family that was imminent, and it was very sad and moving in some ways, because this my aunt was like a second mother to me. But I had a chance to say goodbye, and I had a chance to see my family in New York, and it made me think about my family heritage, and I found out a lot about all the information about my Italian-American family with all the documentation that my uncle had set aside. So that was fascinating and, happy and sad at the same time. Happy to see my cousins, but sad to really miss a woman, Muriel Junta, who was a big part of my life growing up. So that's all I have. Thank you.
Oh, thank you. Commissioner Savis.
Yeah, I don't have much to say other than, I know we're hitting a political season here with a election coming up on November 3rd, and it's always sometimes concerning when we hear people miscommunicate things, whether it's by accident or they don't understand the full picture of things, or they are deliberately. It's hard to say, hard to know which one it is. But in the end of the day, we hope that our citizenry out there have good information. And I was talking to one of the city commissioners in Oregon City with regard to the buzz around the courthouse demolition and the sale of the courthouse, for example. So I think there's efforts to clear the air, to restate some of the information out there, but it became even more evident last Thursday when we were at our luncheon, when we found out that there's someone out there doing a blog, basically, and trying to basically paint that we didn't have much of a process for a public process for the courthouse, when indeed we had. How long was that, Gary? Was it 2 years?
2 years, yes.
2 years. So I think people might criticize us for 2 years is a long time, but on the other hand, we have people saying as though it was a couple of weeks. So it's always frustrating, and always trying. I think we also have to work hard, whether that's ourselves or public and government affairs, to try to keep up with all that. It's a lot of work to try to keep up with that and message what the facts are as best we know. And I'm hoping that it's going to be almost 2 months since Election Day, May 19th. It's almost 2 months. And what's on top of mind for me is making progress or maybe hearing more about our path for the sheriff's levy, right, and the public safety levy, that is. And so I'm anxious, as I shared with the chair, want to see some activity towards there and like to see or hear from our sheriff as well on this. I think it's, if I recall right, when Chair Roberts, when you were the sheriff, I think you were the lead guy on that.
A little exhausting.
So, hoping we can, again, work together to get something launched here. So, Chair, I yield back.
All right, thank you. Commissioner West.
Thank you. We'll also be at NACO. Excited to do that with Commissioner Schrader. It's always a great learning opportunity, an opportunity to network and to advocate for Clackamas and bring really good value back home. There's just so many examples where there's been a lot of benefit, not just from the national level, but also the local level. And so there is a benefit to that. And one of the ways I've been engaging with NACO the most is around natural resources, ONC lands, federal involvement in that. Has been one of the big, more national or regional approaches that NACO has been really helpful with. They also are really helpful with healthcare policy, what's happening in other jurisdictions around H3S and all those things that we deal with. So I look forward to that. We leave tomorrow morning. We'll be like Thelma and Louise on United Airlines tomorrow, early, bright and early. Let's see. I'm excited for the conversation we're going to have this afternoon around the hot topic around buffer zones for the exchange of syringes. That conversation will be happening later this afternoon. And had a great 4th of July. I didn't get a chance to say anything about that the week before. America 250. It's a little past that, celebration now, and it looks like everybody made it through. But I was in DC and Philadelphia during those events. I do have to say that the fireworks show was wild. It was enormous. And so that was like nothing I've ever seen before. But enjoyed that. I hope everybody had a great 4th of July and is enjoying their summer. And that's all I have this week.
Thank you. Commissioner Helm.
I'm going to leave it to my esteemed colleagues to represent us at NACO. I can think of a million places I'd rather be in July. New Orleans is not one of them. So me and heat don't get along real well.
We're going to have that.
Yeah, you are. A little bit of humidity, too.
Yeah.
I want to echo a little bit of what Commissioner Savas said. It is kind of, we're gearing up for the general election, and there's a lot of misinformation that does make its way out into the to the internet. But I also want to say that this board is we're very transparent. We have really good conversations. I have found nothing nefarious coming in. Being only here just a little over a year, you guys have had many, many thoughtful conversations around the things that I have subsequently voted on. I did my homework on all of them before I did vote. So all of that is on record, and it's on previous meeting, minutes, and also on video. So I encourage people to go back and spend the time. It does take a lot of time to go through and find that information. And then there is also some social media stuff that concerns me about downtown Oregon City. And when I was at Watershed Cafe the other day, was speaking to Tara, the owner, and how, there's word that, little Oregon City is all dried up and everybody's leaving. And that's not the case. And they are very, very excited about this project that's going to be happening across the street from them. So, there's a lot of businesses to visit in downtown Oregon City, and I encourage people to go down. It's a fun little town, and parking is easy, and it's only going to get better from here between the Tumwata Village and the new complex that Level Development is building. It's going to be pretty fantastic. So, and then this weekend I visited Sandy Mountain Festival on Sunday morning. Oh, yeah. Oh my gosh, it was so gorgeous. My son and his wife and 2 grandbabies were there. So watching my little toddler grandson trying to navigate these little hills and stuff with all the trees and everything. He just wanted to touch every plant. He's like, just loves plants. So it was cute. And I got a little bit of shopping done. And it's one of those wonderful, very unique places to have a festival
so fun.
because the trees are so gorgeous and it's just a beautiful place to be. So I did that, and yeah, I'm going to yield back because there's a lot of stuff still going on this week and next. So
Busy time
Busy
coming up.
times.
Yeah. Just a couple quick comments, and this actually came out it's June 29th. I think I saw it about the 1st of July, but Oregon U.S. Senators Merkley and Ron Wyden announced that counties throughout Oregon will receive a combined total of over $52 million in payments in lieu of taxes, known as that PILT funding for 2026. And to remind folks, it's because local governments can't tax federal lands, and annual PILT funding helps defray those costs associated with maintaining important community services in the county and federal lands. I know Commissioner West was also involved in that. For our county, letting you know that payment ends up to be in about $1.3 million, and our total acreage of federal land in our county is about 617,000 acres. So I think that was a great accomplishment, and thrilled to see that we're getting some money for that. And really to follow up with Commissioner Savis's comments, one of the things that I want to start doing was, and Commissioner Helms kind of framed it as listening sessions versus town halls, which I do like, and I think trying to connect that with talking about the public safety issues that are in front of us, and maybe some coordination. I don't think the whole board needs to go at one particular time. We might kind of work with staff, identify some areas in the county where we can kind of go out and go, hey, here's what the public safety is about, and really have a really kind of a united effort on educating the public about those resources. So I kind of plan on starting to do that. I've talked with Gary a little bit about that, and if anyone would like to kind of join on that front, we can kind of work on that. Gary, did you have any other comments?
Yes, so the chair is informing you, he's going to start doing listening sessions around the county. Do any of you want to join him? But it would not be all 5 of you. If you do, we'd break you up into groups of 2.
Yeah.
So would you tell us now, do you want to do this?
yes, I do.
Commissioner Helm, Commissioner Schrader? How about you, Commissioner
Oh,
Savage?
yeah, it's just a matter of calendaring.
Yeah.
So I think
We
it's
need
just
to be
working.
strategic and make sure we don't I think that's what you're trying to do.
Yeah.
Yeah, just some coordination and making sure that we're getting throughout this big county in different areas. And so you might already be up at some area, and I think we're just kind of working on some facts to make sure that we're kind of have
Okay.
the same message, there's not any confusion. So I think just kind of working towards that.
Do you anticipate the sheriff joining you? Sheriff
Yeah,
Whitley?
I think it's that and others, really, of trying to kind of form really a coalition to educate the public about where we're at and kind of what's coming. So we have some decisions to make, and as soon as those are kind of decided, whatever we do, then making sure that we kind of carry that forward.
Okay, all of you are interested, so we'll work on groups of 2. We'll work with your calendars and your staff, and we'll get something organized as soon as 2 weeks from now when you're back. On it. Thank you.
So that is all I had. So thank you all for joining us this morning. We're going to be back here at 1:30 with another full agenda. So with that, we'll be adjourned. Well, welcome back this afternoon, everyone, to our policy session, July 14, 2026. County Administrator Gary Schmidt, would you please call the roll?
Yes, thank you, Chair. Roll call. Commissioner West.
Here.
Commissioner Helm.
Here.
Commissioner Savis. Present. Commissioner Schrader.
Here.
Chair Roberts.
Here. All right, Gary, what do you have first?
Thank you. The first session today is Performance Clackamas Strategic Goal Implementation Update for the Board, your transit goal. Staff has some questions to ask you, and they are Mary Rumbaugh, Director of Health, Housing, and Human Services, and Dan Johnson, Director of Transportation and Development. Go ahead, please.
Good afternoon, Chair Roberts and Commissioners. As Gary noted, I am Mary Rumbaugh, H3S Director, and joining me is Dan Johnson, Director of DTD. So we are here to finalize the definitions that are used as part of your transit goal. As a reminder, your goal is that by 2027, the county will provide a plan for what efficient, accessible, and affordable transit looks like in Clackamas County. The transit implementation team made up of staff from DTD, H3S, and our Social Services Division are responsible for moving this goal forward. At your February 3rd policy session, we proposed a working definition for efficient, accessible, and affordable. During that session, we received feedback on the definitions, in particular related to accessible. Why are affirming these definitions so important? A lot of work is going into our county's transit development plan, which includes the use of the definitions. It is important that all involved are working with the same understanding of what we mean when we say efficient, accessible, and affordable. As a reminder, here are the definitions as initially proposed, and I'll highlight the language change based on the feedback from the February policy session. It's up here on the screen. You'll actually see the underline is the words that were changed. So no changes to efficient, a reliable and well-coordinated network that maximizes resources. Accessible had the most changes, designed and delivered so all individuals can safely and independently use and understand it. And affordable maintains fair and operational costs that do not create financial burdens for riders or threaten long-term system sustainability. I will now turn it over to Dan to discuss the progress on moving forward with the county's transit development plan.
Great, thank you so much. The long-range planning program within DTD is responsible for updating the county's transit development plan. The core work of the TDP update will focus on identifying efficient and accessible transit options which align with the state transportation planning rule requirements to identify gaps and deficiencies in the transit system. That's required by statute. Originally developed in 2021, the Transit Development Plan was created to provide guidance on transit connections between existing providers outside of the TriMet service area, as well as input into the transit service within TriMet's service area. The TDP includes transit project priorities to connect communities within Clackamas County, both urban and rural, and provides guidance on infrastructure investments needed to support transit use throughout the county. The intent of the TDP is to communicate a connected and coordinated vision for transit service and access to transit within Clackamas County. Is it a key document used to inform the county's STIF plan, like the one you approved last week, which was reviewed by the board and was approved. Currently, a request for proposal, an RFP, to update the county's transit development plan has been published. This portion of the project will be funded by the local state transportation investment funds, the STIF funds, and included in the county's 2025-2027 STIF plan. Affordability, the third objective, is the board's goal, is outside of the funding objectives for the STIF funding secured, so we're looking for other funding for that particular element. I wanted to make sure that you were aware, though, in order to integrate a task related to identifying affordable transit options, additional funding will have to be made available. Having said that, though, we're assessing those options for available funding and bring those back for consideration by the board. And we've also developed language in the RFP, which has been added as a contingencies task to that work to identify alternative models for providing transit service that align with the BCC's transit goal of affordability. The additional analysis will focus on how transit service is provided within the area currently served by the TriMet Service District within Clackamas County, as well as the areas outside of existing rural and small transit provider service districts. It will analyze the impacts of implementing various service models on cost, accessibility, and efficiencies. This additional tax will be integrated into the contract if funding for this work can be identified. Just a rough estimate right now, we're assuming this effort alone was going to cost about $70,000. That's kind of what our preliminary estimate is when we look at the task at hand and the cost we're seeing from our consultant community. With that, I'll turn it back over to Mary.
Yeah, so just for today, really in conclusion, we're really just asking that the board affirm the definitions of efficient, accessible, and affordable. In particular, the language changes that we did make based on feedback that we received specific to accessible. So that, again, just becomes really important so that when we do bring a product back to y'all and we have said, okay, this is what accessible or affordable means, that we are all working with the same understanding, and this really just affirms our ability to move this work forward. So that's really our ask today.
All right. Questions? Go ahead, Commissioner Sims.
Yeah, I don't have a problem with the definitions. Just to qualify what I'm about to say here, just so you all understand a sense of the conversations I'm engaged with right now. I am the Associated Oregon County's transit representative that sits on PTAC, which is the Public Transit Advisory Committee put on and convened by ODOT. So I have that hat I wear, and then also I just got off the phone with one of the mayors, and I have two more mayors to talk to, hopefully today and tomorrow, about transit. Transit is one of those issues. So the conversation I just got off the phone with in regards is that 2 cities from Clackamas and 2 cities from Washington County are engaging in a study right now to figure out what their needs are. Right, and in this conversation, I didn't expect this, but not a big deal. But pointed out that they really got what they feel is a really good contractor. I don't know who, our person to do the work, consultant, whatever it may be. So, am I ready to take the next step? Yes, I want to make sure we get someone well. And the last line where it says affordable and maintains, and Dan, we can't do anything without resources. But I think what I would like to see, I don't think the last study had this. I know that HB 2017 was barely understood, let alone in the works at the time when the last study was done. But I would like to understand where the revenue in Clackamas is generated from, right? So the typical transit tax is generated by companies, employers. And with the HB 2017, revenue is generated from every employee. So the premise was that every employee who pays in, or every employee would have access first and last mile to the transit system. So I think once we understand what those revenue streams are, my hope is that if an existing agency is collecting the funds, but they can't deliver the service, but they're collecting in that area, maybe they should either give it up or contract it, right? And I don't know if that's possible. I will be meeting with one of the members of the transit board. It's on the governor-appointed transit board. I think that's next week. So I'm having a lot of these conversations, but I'm a yes on all this. I don't have any problem with anything, but I want to make sure that the work we do is a way to at least assess and look at the revenue streams that are out there. No one can afford a new one. They shouldn't be paying 3 times, right? There shouldn't be the employee tax and the employer tax and another one to make this all work. And fares is a common thing that everyone's doing, so it's going to have some fare. But I just think there's just a lot of real estate, and we call them the deserts, that has no transit whatsoever. So yes, go ahead and step on the gas.
Thank you, Commissioner.
Any other questions or comments? Is there a motion then?
I move to affirm the definitions of efficient, accessible, and affordable as presented.
Second.
Commissioner Helmuth moved to affirm the definitions of efficient, accessible, and affordable as presented. Commissioner Schrader has seconded that. Any further discussion? Seeing none, clerk.
Well, yes, actually.
Yes, go ahead.
The motion is very vague, and you mentioned the study and the $70,000. So is that part of this?
No.
Yes, it's not part of this. We're actually working with
affirming the
Nancy
words.
Bush, the Chief Operating Officer, to bring back a request for, a total request for funds for a number of the implementation teams that are underway right now. That ask is a part of that discussion we will be bringing forward to you shortly.
Okay, so just roughly, you say shortly, roughly a month or?
We just got confirmation from Nancy today.
July 28th.
Okay,
We'll be back.
okay, all right.
Apparently, it was July 28th.
Okay, Chair, back to you.
All right, clerk, you please call a poll.
Commissioner West.
Aye.
Commissioner Schrader.
Aye.
Commissioner Savas.
Aye.
Commissioner Helm.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you so much.
Thank you. Gary, next.
All right, you're ahead of schedule, and I don't see the assessor here, although we warned him to please come early. So we can take a short break, or we can jump ahead and do the third policy session because staff is in the room.
Why don't we do the third? Is that all right?
Okay, come on back. So we're jumping ahead, 2 policy sessions. This one is the Syringe Safety Barrier Ordinance, Part 3. Our third time back to you. Presenting is Mary Rumbaugh, Director of Health, Housing, and Human Services, and Andrew Naylor, Assistant County Counsel. Go ahead, please.
I'm in a different seat. Good afternoon, Chair Robertson, Commissioners. So myself, Mary Rumbaugh, H3S Director, and Andrew Naylor, County Counsel, we are back here in front of you to discuss a possible ordinance related to the Syringe Service Program, or SSPs, and whether that ordinance should be adopted. I want to highlight a couple of takeaways from the last 2 sessions. So in the last policy session, Chair Roberts asked about applying the ordinance to also fixed locations. Right now, the draft or the original draft ordinance, as well as the previous legislative concept, was specific to mobile SSPs. So the draft ordinance in your packet does include language around fixed and mobile. Also at the June 23rd session, there was discussion amongst the board about adopting an ordinance but not enforcing it. And in our first policy session, staff had actually proposed potentially implementing a county policy that would restrict any county contracted community-based providers operating mobile SSPs from, it would prohibit them from providing services within 1,000 feet of a school. I also want to note that since the June 23rd session, Multnomah County did adopt their ordinance limiting mobile SSPs from operating within 1,000 feet of schools. Throughout this discussion, one common issue continues to be identified. Regardless of whether we're talking about incorporated or unincorporated parts of our county, and that really is the lack of access for safe syringe disposal for our community members, regardless of why an individual may be using syringes. So H3S continues to be interested in exploring expanding access for syringe collection infrastructure, modeling the Metro pilot syringe disposal drop boxes, which are going to be located, in fact, I think they may be already up, located one at Beaver Creek Health Center Clinic, so here on our own campus, as well as the Happy Valley Police Department. In this case, that program, if we were granted permission to move forward on exploring opioid settlement funds, would be an allowable use for that proposed project. So I'm going to go ahead and turn it over to Andrew, who can walk through some of the draft changes in the ordinance, any legal considerations, and as I also just want to acknowledge something, Chair Roberts, you also asked at the last policy session that we did not answer. And so I'm hoping we can sort of play out the scenario, which was your question is if this ordinance were to be adopted and impacted fixed locations, but then a school came into that parameter of that 1,000 feet, what would be the impact? Who would have to sort of move, or would there be an exception within that ordinance to allow for that to be figured out? So I hope you can remember that you asked that question. So I think we never got to answering that. So I'm going to turn it over to Andrew.
Good afternoon, Commissioners. To that specific question, it would really depend on how the ordinance is drafted. Assuming the board wants to pursue something along the lines proposed here, we have a series of exemptions in the ordinance. So if a school moved under the current form, the county would have to exempt the SSP organization. It wouldn't be automatic. We could consider a mechanism to make it that way, but we'd have to sort of think through how that would work. So like Mary said, you've had 2 versions of the ordinance. These are all just drafts for discussion purposes. If the board decides to pursue an ordinance, we would have to do first and second reading, so there would be yet another version down the road that we'd have to discuss. It's pretty short the way it's drafted. It's just essentially a series of definitions, who it applies to, who's exempted. The last draft exempted medical facilities if we were thinking about brick and mortar organizations. Prohibited activities can't be within 1,000 feet of a school. A series of exemptions that the county has some control over. The idea being it would hopefully make this ordinance more defensible, allow for flexibility as things come up for the county to deal with it, so it's not just a hard and fast rule. We could have some flexibility on our end to make accommodations. And then we'd have to update the code enforcement provisions to capture this new law. So that's kind of the structure. Again, they're all just drafts. They're all just discussion purposes. So looking for guidance from the board on how you would like to proceed.
Great.
And I do, I was also asked by county administration to address really the startup to full implementation of an ordinance, because we have not yet identified a funding stream. We do know that opioid settlement funds would not be an allowable use for this. We were asked to look at what staff capacity can be redirected or reprioritizing existing work or delaying other program activities. As we envision enforcement now, that would fall under the Public Health Division. And so we have looked at what would the trade-offs be. We could redirect some of our administrative capacity within our environmental health team. Remember that there is an enforcement, a complaint process and an enforcement. So that would fall to the environmental health team. Because of the complaint and citation system, which could delay food, pool, lodging license processing that we do. That could result in delayed revenue collection and impacts to businesses if there's a delay in us doing the work that we do for them. We would need to redirect a portion of our program staff capacity within our substance use prevention program. Currently, they're doing trainings around use of naloxone, distribution. They provide technical assistance and monitoring to our current funded contractors using opioid settlement funds. So we need to pull a portion of their FTE in to have oversight to this particular program. So I feel like I hope I've captured many of the things that I've heard over the last two sessions, and Andrew and I are happy to answer any questions at this time.
All right. Commissioner Savas, go ahead. You have a
Yeah,
question?
so Andrew, when you were talking about exemptions, like if a school moved, right, the exemption would apply to those that with fixed locations or fixed and mobile?
The way it's currently drafted, that specific scenario isn't contemplated, so we would have to come up with language if we want to create an exemption. The ones we had proposed are things like to respond to a public health emergency, to ensure access for healthcare services for individuals who just couldn't get the services without the exemption. We had drafted with when the county decides it's in its best interest. So there's a series of broad exemptions, but not specific to that scenario. So if that's something the board would want to consider, we'd have to think through what that language would look like and propose it in any kind of final ordinance.
Okay. Thank you for that. Today, I am all in on option one, having the receptacles and the places for those to be dropped, and I know that would be a safety improvement versus them being thrown about or, not properly disposed of. Commissioner West and I spoke recently about this, and I'm wondering, and I know that Commissioner West and Commissioner Schrader are going to NACO, but I'm just wondering if there's a way to, whether it's staff or my colleagues I just mentioned, to find out if there's some examples around the country of a program like this working, and look at this, what's working, what's not working before we jump through that next step. I appreciate, Mary, you bring into attention how you would staff this, so to speak. But I just want to have a sense that it's worth doing, in the sense that there's examples where it does work, right? So I know that Multnomah County just did it, obviously, as you stated, and I guess Roseburg did it, I believe, not too long, or Douglas County.
Something along those lines, yeah.
But, something that's been around for a year or two or more, right? Ideally, just get a sense of how effective it really is. Chair, I yield back.
All right, Commissioner West.
I will piggyback on those comments. There are examples, just a little research, and then we can get more specific. I don't oppose coming back with those more specifics and looking at best practices, and I'm not opposed to that. But there are 2 states that recently passed statewide mandates. Indiana is a 1,000-foot buffer, and it's around schools. I don't know if it's just schools, but they do have a 1,000-foot buffer around schools. And I think for over a year now, West Virginia has a statewide ban. I think it's 2,000, similar to the ordinance that was brought forward in the state legislature this last legislative cycle. Local municipalities, there's a few in California. We have Orange County, Casa Mesa, have a history of these types of ordinances. Santa Ana, California, they've all kind of codified on a municipal level, a local level, how to deal with this issue. One-for-one exchange restrictions and things like that. We have Lewiston, Maine, and I think Roseburg has done something along these lines. I don't even think they allow, I don't know if they have a total ban on services, but there's some restrictions. I can't remember off the top of my head, but I read about it. And I think there's another example out of Denver, but I know you can get more specific. I think it's educational, look at different practices and where they've done this across the country, totally supportive of it. I know some of the concern has been around the letter that the ACLU sent to Multnomah County when they just recently passed their ordinance on this issue. And I don't know if the board has questions or wants to discuss that. I have thoughts around that letter and what I think are some of the critical flaws in the letter as presented by the ACLU. I think that the Board of County Commissioners of Multnomah County actually makes some great points regarding that. We're not looking to outlaw or ban anything outright. This is more around time, place, and manner restrictions and looking at different populations and managing not just those that have substance use disorder and need services, but also children in the community and families, and weighing that balance equitably. And I don't think the Lewis County case is super applicable because it wasn't even a ruling, it was a settlement. So it wasn't a ruling in that federal court, which the letter fails to note, which is the truth. But I don't think it's applicable because this isn't an outright ban and the services are available and it doesn't even impact the 2 locations that we currently have within the county are not impacted by this. And I think that it's not an ADA violation because we're just kind of utilizing our zoning power. We're not banning it. We're just zoning it away from schools, time, place, and manner, which I think is appropriate as a local government. And we have to balance out these services with the safety of kids and students and families, right? And that's a fair balance to try to strike. I also think that this is important and timely because as the larger counties step up and address this issue, it is going to put proper pressure on the state legislature to potentially do something here and to act. And I know that Senator Reynolds is looking at this closely. So I support moving forward with this. I think if you look at it, it is super pragmatic. It is very moderate. It is very balanced. It is not an extreme policy by any measure, nor was that the desire of anybody to do such a thing, but we're trying to strike that good public policy balance. And we don't, thank God, have the same problem as Multnomah County, who did take action, but we do share a 10-plus mile border with them, 12-mile border with them. And I have seen, and many have seen, and complaints have come, where we have seen some of this biohazard litter come in different places in the county. And so we also don't always need to wait for something to become an exasperated giant problem before we act and just do good public policy either. So that's kind of my thoughts on it, but I know that some of the concern was since our last meeting, the ACLU letter came through. I do think that Multnomah County, I appreciate the comments from those commissioners. I agree with them on that, on pushing back on that ACLU letter. And I do think that this is good policy moving forward. So I'll yield back with those comments, and I don't know if anybody wants to discuss those issues that are brought forward.
All right, Commissioner Schrader.
Yeah, I've just actually looked at the NACO website and put in the filter syringe collection and disposal, and right now, there doesn't seem to be any post that matches that criteria is what I'm getting. So it might be necessary to use other frameworks or words to do a search, because I would suspect there is a body of information that they have nationally. Because my question is, where does this belong? Does it belong at, because you mentioned counties, was West Virginia, Indiana and West Virginia, those state?
Those are state, but then
Those are
many
state.
states kind of push it back to municipalities and
Well,
counties.
that's kind of what I was
To choose.
trying to figure out where,
Yeah.
where it lands.
And I can
or
ask,
something.
I'm on that committee at NACO, I can ask.
Okay,
I'll follow up at NACO too.
Yeah.
And then we can circle back when we get back, I'll ask for guidance.
yeah, because
Yeah.
right now, again, looking at their resource library is where I just took a quick look, and it didn't. So I think that's something to get started, but if you're on that committee, again, I'd like to know what the majority of jurisdictions are doing this, county government, basically, be my question.
Can I ask legal counsel really quick, like, is it fair, looking at this from a zoning standpoint, that it's not an ADA violation to do time, place, and manner for different populations, right? Like children are also vulnerable populations, and those that have substance use disorder have their own needs and concerns. But to look at this through a time, place, and manner in a limited way, is that fair? Like, because we have that, ACLU sends the letter. I'm not a lawyer. Y'all are lawyers, so I'm just wondering your thoughts on my comments. Or am I looking at this in a reasonable way?
So the way we had proposed the ordinance, and again, just a proposal, it's just for discussion purposes, was not to put it in our ZDO. It's just a standalone ordinance, because the original thought was we were looking at mobile SSPs. And so the idea was we didn't need to worry about the brick and mortar location. So that was why it's sort of out of our ZDO. Whether it's a reasonable balance, the Lewis County case is new. It's unique. As far as we know, one of the few cases to specifically evaluate the ADA and syringe service programs. It wasn't appealed, so it's hard to say what kind of precedent it sets. I think Oregon courts would look at it if they were considering a similar issue as not persuasive, but at least something to consider as they make their own decision. So it's a very unclear way of saying it's undecided, so I'm not sure how an Oregon court reviewing this specific issue would judge it. You would hope there is some balance between what the ADA provides and public safety issues regarding needles. Whether courts ultimately can construe these cases saying SSPs can't be banned under the ADA, that seems like an extreme result. But again, I'm just speculating because there's just not that legal authority to look at. It's just that one decision on this specific issue.
And I would just say that creating buffer zone is not providing care either, right? Like it's looking at two different populations and then trying to find good balance between them. So we've never made the argument from this dais that we want a blanket ban, but we're trying to find that balance that brings that sense of livability and safety to the community, to other populations also.
All right, Commissioner Helm.
Okay, so right now, an SSP can pull up next to a school and operate. A mobile SSP can pull up right next to a school and operate, correct?
Correct. Right.
Like go in the parking lot, basically, and do a syringe swap, right? Okay, so I'm just pointing, my way of pointing that out. Now, why would anybody be opposed to I don't understand the pushback we've gotten, and maybe Commissioner West can help me out with that. Why would anybody oppose the 1,000-foot limit? I just have trouble wrapping my head around why anyone would be opposed to that.
So actually initially, when this was being proposed in the most recent short session, we did provide suggestions to edits to do that 1,000-foot buffer. So I think frankly, for H3S and our public health division, the concern is we're trying to solve for something that is not yet a problem. We also want to continue to be advocating for the ability to have mobile SSPs, because they do more than just Syringe exchange. They're educating on lots of other, diseases and all of that. Really, our position just continues to be our concern about the work for having to implement an ordinance, in which we also believe that the state will be taking this up again in the long session. And so is there an opportunity to just observe and sort of, likely be told, you're going to be adopting this anyway?
Okay, and then my third question is more for Andrew or for Billy. Just ballpark likelihood of litigation based on the ACLU letter that went to Multnomah County, they instituted this anyway. What do you see happening there? Not that you have previous history, but just.
I have no crystal ball. I would say the
None of
fact
us
that they
do.
sent a letter to Multnomah County, if I was to speculate, that means they probably are considering litigation against Multnomah County. Whether that would come to Clackamas, if Clackamas passes similar ordinance, I don't know. They would have to find a plaintiff to represent as part of any lawsuit, and I don't know if there's a plaintiff in Clackamas County that would have standing to sue us. I mean, it's all speculative.
Right.
So what I would say is the fact that they took the time to send a letter tells me they're serious about potentially challenging at least the Multnomah County ordinance. And that's about as far as I could speculate. So I couldn't put a percentage, 50%, 60%. I just don't know.
I think there's a strong likelihood that whether it's Multnomah County, Clackamas County, or any other county who passes it, I think we have to assume, like Andrew points out, once a plaintiff is found, especially under the ADA provisions, that there will be litigation. I viewed the ACLU letter as, they're trying to be informative. I'll give them credit for that, but it's also a bit of a, if you will, a shot across the bow, a warning. It is the way it is. And to go back to Commissioner Savas, the point that you made, and to follow up with what Commissioner West said, I think other entities are studying this, trying to figure this out because it's new. And one other possibility in addition to NACO would be the Foundation for Drug Policy Solutions, Dr. Sabat's other organization that was started with former Congressman Kennedy. They do obviously a lot of work, a lot of research, and they're always on the Hill on a variety of issues. They would be another good resource for us to be looking at to see what their research has shown. And I mean, they are at the tip of the spear on so many things related to this subject. And I want to see what they have.
Yeah. Okay. All right.
They
Thank
have
you.
a great board of directors. I'm involved in that organization just on an advisory capacity, and they do great work, so it'd be worth looking into.
Okay.
All right. A couple comments, and I'll turn to you, Commissioner West. I think that I'm kind of along the lines of Commissioner Savas. I think it's great for syringe collection and disposal boxes. I think that I do like the idea of kind of seeing what's going on at AOC or NACO as another issue. And I think one of the concerns that I have, and I'll just kind of say it, is that you said it very well. It's called trade-offs. Because you just only have so many resources, and you have to really kind of prioritize. And I know your office in particular has had substantial cuts in the last few years. And as you make those cuts, a lot of times you have to make tough decisions, which I don't think are fun for any of us to do. So to add another thing on there is a concern. My second point is, I am reasonably risk averse and sometimes like to step back and kind of watch to see what happens. The comment that you made, it's not yet a problem, And I think that, taking a step in the right directions for the disposal boxes is great. Looking at some other options nationwide, making sure that we're just being extremely cautious. I mean, I appreciate Commissioner West's thought on this, protecting our schools. I think council can also kind of support me on this, is there's, for those that are consuming drugs intravenously or that, and drug trafficking, there are crimes for distributing within 1,000 feet of a school. So I know a lot of people that, because I used to work in the narcotics unit, they didn't want to be near a school because that's usually where the cops were at, right? So there is some sort of deterrent there. But I think other deterrents, are helpful as well. I mean, I do want people to get help and resources, and I think I wholeheartedly believe in recovery and Medicaid-assisted treatment. So I'm not saying that that isn't important, but I think looking at resources and staff is a concern I have. So, Commissioner West, you had a comment?
Yeah, I mean, I totally agree with figuring out how to have better and proper disposal of biohazards in syringes. I mean, much of that applies to a lot of people that have nothing to do with substance use disorder throughout the community. And most of them are throwing them in our garbage, which is not the appropriate way to get rid of a syringe. Totally agree with that. And I think it doesn't necessarily help syringe litter either, because the people who are littering aren't going to go and look for a box a mile away to drop their syringes in. Diabetics, use of hormone replacement therapy, GLP-1s, the pens. There's just so many different everyday medications that people use for sub-Q or intramuscular injections that are totally not applicable to this. However, it's still really good public health policy to have those things properly disposed of the right way, and I think that we should look at every avenue to do that. That's good public policy. So yes to that. Yes to the coming back with a better picture of like what it looks like in other jurisdictions just for education. When you read the letter from the ACLU, it talks about kind of like it's going to result in intimidation and harassment, kind of this fear-mongering a little bit within the letter of arrests and of public health workers. It kind of gets a little bombastic and a little hype. It's a little elevated, the language from the ACLU. But am I right that this is going to be complaint driven like much of our ordinances and enforcements, and there's not these proactive police sweeps happening, right? There's not this, we're not going to go, none of that is being proposed. Am I correct? And the ordinance is complaint driven, which isn't likely to result in this mass harassment of public health workers.
That's correct. It's complaint driven. It's focused on the behavior of the littering of needles. I mean, that's what's trying to be addressed. It's not about people who need to get medical services. It's not about the individuals. It's about this specific behavior. And so it would be a complaint driven process.
Okay, it's just a little different than the language that was in the story, the narrative painted within the ACLU's letter. So I just wanted to clarify that since it's been put on the record. I don't know what a motion looks like today. I am totally open to, I know there's probably an option here for is that option one? Wait.
No, there's actually option 4, I think.
No, option one is the move forward with the disposal boxes, which I don't know, colleagues, if we're ready for that while coming back for round 4 on the additional questions the board brought forward. I see a nod from Saab. I'm just trying to make sure where we're all at.
Yeah.
Can we do 2 of them?
Yeah, what I was going to do is just make it simple. I'm going to make a motion for option 1, and then then following that, let's make another motion to direct staff to do some research. And I also want to reach out to someone with ADA to figure out, I want to understand where the ADA is coming from. Because I don't know that world, and I think it'd be valuable to understand what challenges they see with that. So I'll start with number 1. I move direct staff to further explore the addition of public syringe collection and disposal boxes in strategic locations throughout the county.
I'll second.
All right. Commissioner Savas has moved direct staff to further explore addition of public syringe collection and disposal boxes in strategic locations throughout the county. It's been seconded by Commissioner West. Any further discussion? Martha, did you want to say something now or later?
I just want a quick comment that was perusing where this is happening, and Seattle and King County, their public health department, has a continuum of care, treatment, harm reduction, peer-reviewed, so on and so forth. And syringe services program is something that they're actively doing. So that might be at least a Pacific Northwest model we can take a look at. So
All right.
just a comment as I was looking through the materials.
So with the motion on the table, I think we might go ahead and move forward with the poll. Clerk, you want to call a poll for us?
Commissioner Schrader.
Aye.
Commissioner West.
Aye.
Commissioner Helm.
Aye.
Commissioner Savas.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
All right. Commissioner Saus, did you have a second motion?
Yeah, I move we direct staff to do some further research and look for other examples nationally, as well as try to better understand or reach out to the ADA to at least enlighten us as to how they perceive this. And that's my motion. I have comments after that, but
I'll second that.
All right. If I got this
Any
correctly.
clarification on your motion?
Just clarification, Commissioner Saus, when you reference ADA, to reach out to the ADA, that's an existing body of law. So,
who represents the ADA then?
well, it's a statute. And so there are attorneys who bring lawsuits under the ADA provisions and those who defend. So Andrew and I can do a little more research on if there's a national, I'm thinking of SAMHSA maybe as one resource to reach out to as well.
Yeah, well, we can look in, I mean, there presumably is a federal agency.
Yeah.
How about if we just had council research other
Yeah,
legal?
that's fair enough. And thank you for enlightening me and educating me on that. You're right. Americans with Disability Act is not an organization, or an administration. So
It's under SAMHSA, probably the drug czar.
Yeah.
Right. There's, I forget all the federal acronyms. I should have them memorized, but it would take a 4-inch 3-ring binder to list all of them. But yeah, we'll figure out what that connection is.
Can we add the drug policy solutions group into that also as a resource?
Yeah,
I think it's smart.
absolutely.
Yeah.
I think they'd be very helpful, but yeah.
Yeah, my comment I wanted to make, the motion's on the floor, and it was seconded. So what the comment I do want to make is, I do recognize that people have syringes for very legitimate reasons for their medications and so forth. So I totally understand the need for clean syringes to keep people healthy. So it shouldn't be that this is just about a illicit drug issue, right?
Right.
So I want to make sure, I want people to know that I understand that. And I want to understand this as fully as possible. So thank you.
So I don't think we had a second, though. We had a second on the other one. Oh, you did. I didn't hear that. Okay. So on this second motion, Commissioner Savas's motion was to direct staff to further research other examples nationally and have council research other entities to include the drug policy research. And that was seconded by Commissioner Hill, correct? All right. Any other comments? Points? Yeah, I also wanted to make sure that that was perfectly clear, that this is not for just illicit. I was just pointing out the fact that there are crimes or laws under the books that associate with that as well, but that's not related to this. So with that, clerk, will you please call the poll?
Commissioner West.
Aye.
Commissioner Schrader.
Aye.
Commissioner Helm.
Aye.
Commissioner Savas.
Aye.
Mr. Chair.
Aye.
Motion passes 5-0, Mr. Chair.
Thank you both. All right. With that said, Gary, we have one more. One more.
Back now to senior property tax. Oh, darn it. And one more going back to senior property tax deferral and exemption programs. Presenting is the county assessor, Bronson Rueda. Thank you.
All right, good afternoon, commissioners. Thank you for inviting me here today. I've heard a little bit about what you want to talk about, and if you have a different direction than where I go, let me know. But I'm going to start off by giving a high-level overview of the senior and disabled property tax deferral program. Does that sound good?
Yep.
Okay. All right, so the senior deferral program, I'll refer to it, that is a program that is administered by the Oregon Department of Revenue, and it's designed to be self-funded, meaning money that comes out is funded by people coming into the program. And the applications can be filed, are typically filed at the county level. They can also be filed at the state, but they're typically filed at the county level. And then we help applicants fill it out, and then we send it down to the Department of Revenue with documentation, like a deed and tax statement that helps them determine application eligibility. And then once approved, the state pays the taxpayer's property taxes to the county of residence, and a lien is placed on the home. So that's important to note, that this deferral program is different than exemption programs, and that exemption programs, the tax is abated and is gone, you'll never see it again. Where the deferral program, the way it's set up is the counties are made whole. So the state pays for 100% of the property tax minus the 3% on time. And then the state is eventually paid back. And then the state is paid back when the taxpayer has ownership changes, which is typically when they die. And they do have to recertify every 2 years to maintain eligibility in the program. And 6% interest is added on each year to whatever their balance is. So for the disabled portion, you just have to be disabled per the state of Oregon and receive Social Security disability benefits and be a homeowner in Clackamas County. For the senior citizen portion, to qualify, you have to be at least 62 and a homeowner in Clackamas County. And there are other eligibility requirements that are tied to income and net worth. For instance, you have to have a net worth no more than $500,000, and that does not include your residence, the value of your residence. You have to have an income of less than $70,000 per year, and have to have lived in your property for 5 years. And that is the bulk of it. There's other small things, but that's the bulk of it to qualify for the senior and disabled deferral program. So it's my understanding you were talking about this program and other possible tax abatements for seniors, but this is the only option my department has to help out seniors in terms of offering property tax relief. If they do come in and they don't qualify, we know right away they don't qualify for this program, then we have pamphlets referring them to DTD and some of their staff that can help to see if they can help further seniors that are in need of financial help or whatever help they may need. So that's a high-level overview of the program.
Thank you. Commissioner West has a question or comment.
I have a couple questions, but I'll just stick to what you have presented before me. When they recertify, are they just looking, when they look at household income, does that include like other assets, or is that mostly income driven? Are they looking at their overall assets for certification? It says home and personal property cannot exceed, so their home can't be worth more than 500,000.
So the RMV of their home, it's a sliding scale. So The 500,000 ties to their net worth, but
Okay.
to calculate their net worth, the value of their home is not included in that calculation.
Okay.
So to be specific, Commissioner West, the $500,000, it does not include the property they are claiming for the deferral, cash value of life insurance policies, or tangible personal property like vehicles, furniture, appliances, or clothing. So net worth, meaning investable, or like retirement assets, 401ks and stuff
But
like
the
that.
income could include like pension income, social security income, military benefit income.
Income separate, so this is net worth. What they're worth on paper, like they have a 401k for $499,000 and that's their net worth.
Okay.
Then they would qualify because that's under $500,000.
That's the 500,000 household net worth. And the income annually cannot exceed $70,000. So they could be getting military retirement income, social security income, not much more they're going to get hit, or even up to that point they're going to get hit. So it's a pretty
6%.
It's a pretty low bar. I mean, it doesn't take much to, and I could see somebody making over that or having more of that and still being priced out of their house.
Yeah, $5,000 a month is 70,000.
Okay, thanks for clarifying that.
Myself. Commissioner Savas.
Yeah, so thank you for helping us out with this. And as I'm reading this, the one sentence of approximately 175,000 tax accounts in the county, Clackamas County here, there's 376 accounts that are using the deferral. So that's great. I mean, people are aware of it then, obviously. And that is here in Clackamas only. Throughout the state, there's more than 376 people using this program, I'm sure.
Correct. That 376, that's households in Clackamas County that are in this program. And to go even further, 91% of those are for senior deferral. The balance is for the disabled portion of this deferral program.
Okay.
So majority are for the seniors.
Okay, well, thank you for that additional tidbit there. The question I had, just kind of building on the conversation you just had, just so I'm clear, so someone could have an $800,000 home, and let's say the RMV is 650, but their net worth is less than 500, they still qualify.
So each qualification criteria stands alone. So what I heard from you is net worth of $600,000, they're out. They don't qualify just off of that alone. It's not if they qualify for 2 out of 3, then they're okay. No, they have to qualify for each set of criteria.
So the equity in the home is included in the net worth?
No, equity in the home is not included in the net worth.
Okay, that's what I was trying to get clear on. So, could you just repeat that one more time?
That's excluded, yeah.
So when you're talking about
I got confused.
When you're talking about the net worth of $500,000, if you're going to add up your net worth, you do not include the value, your interest, or anything concerning your residence.
Right,
If
okay.
you have rental property, yes, but you're not including the residence that you live in that you're using in order to try to qualify for this program.
Right. So I think the way I worded my question, I'll ask it one more time. I believe how I worded it was, if someone has a home that is, let's say, $800,000 market value, the RMV is $600,000, but their net worth is less than $500,000, and they, at least financially, they would potentially qualify.
You just said their net worth is $600,000?
No.
Less.
Their net worth is less than $500,000.
Okay.
But the RMV was $600,000.
So the RMV is another qualification piece, all right? And that depends on how long they've lived in their home. And so it starts, if they've lived in their home at least 5 years, which you have to have lived in your home 5 years in order to qualify, 5 years to 17 years, your RMV has to be no greater than 150% of the county median RMV for that year. And so for Clackamas County, this last tax year, the median was 598,000 and change. And so 150% of that, I have an old set of glasses, so is around 893,000. So if their home is below $893,000, living in there for 16 years, then they would qualify for that piece.
Okay. So the answer is yes, I guess.
Yeah.
That's my question. All right, thank you. I know you all and your staff have all these technical, detailed, I know I admire all of you. I wouldn't want to do that work. I'm always blown away how complex your work is. So I just want to say kudos to you and your staff for all this, and that's why it's so hard to understand. But I'm actually surprised to learn that there's 376 people currently using this. So really, everything that I have seen on the coming from the state legislature as far as bills that is on the property tax relief or abatement, right? The abatement aspect of it, it's minuscule. It's like maybe $70 or $100 a year, maybe. And whereas this is, if their tax burden is $4,000, what you're saying is that whole $4,000 is eligible for a deferral, right?
Correct. It's all taxes or none. You don't get to choose, and there's no option for 50% of the taxes deferred. They're either in the program and get 100% of their property tax deferred, or they're not in the program.
Yeah, I'd probably say if I was in dire straits, I'd probably be looking at the deferral system than I would what any of the bills have for abatement, because it's not. I've never seen an abatement proposal that really provided that much relief.
Yeah. There's pros and cons to it, but it's if the applicant is hurt for cash, they need more discretionary income, and they have no other means to gain discretionary income, whether to cut back on expenses, day-to-day living, then this is a good option for them.
Okay.
There's cons, but it's a good option.
Okay, I'll pause for now.
Commissioner Helm.
Okay, I understand the second paragraph quite well, okay? I want to go back up to the first paragraph. With the loan from the state of Oregon, with the 6% interest rate.
Hold on, can you get to, are we on that paragraph?
Executive summary.
I'm sorry, I'm on the
Do I
executive
control
summary.
this, or? I just want to read along while you're going.
Well, and I'm glad, because number one, is there a time limit? Is there any time limit on how long they can defer this?
Nope, there's no time limit. They do have to recertify every 2 years.
Every 2 years, okay.
And so when property ownership transfers, that's when they're out of the program. And like I said, typically that's upon death.
Okay, and how long has this program been in place?
That's a good question. I don't know when it was implemented. I want to say in the 90s, but I don't know for sure.
I'm questioning the 6% interest rate, and why is that not tied to CPI?
It's not tied to CPI. It's straight 6%. It's been that way. When I started at Department of Revenue in 2011, it was 6% then, so I'm assuming it was 6% previously, and that's never been changed.
Okay, and then so I'm assuming, and help me out here, that if someone dies and they have racked up, I don't know, $100,000, $200,000 in deferred loans, that has to then be added on to the price of the house for whoever ends up with a home to try to sell it.
So the state puts a lien on the house. So when the house sells, then liens are paid off first, which is the deferral program. They'll get paid off first. And then if there's anything left over, then that'll go to heirs or wherever the direction of the estate points the money to.
Okay, all right. I think I understand that, thank you.
Yeah, that's why a lot of times when, I don't know about a lot, but what's happened in the past is when children find out that their parents are thinking about going into this program, they will help their parents out financially to not go in the program, because 6% is a hefty amount of interest to get tacked on to their property taxes each year in order to preserve the house, whether they want to preserve it to get the equity when their parents pass on, or if they want to move into the house when their parents pass on.
Okay. Thank you.
You're welcome.
Commissioner West.
I mean, I think it's really unfortunate if somebody has to take that massive lien out on probably one of the only assets they've had, and they spent their entire life hard working to own that home free and clear. They could even own it free and clear. And then the taxes on the property means they never really own it free and clear, and they they have this massive debt that they can't pass on, they can't or they go in the hole. 6% is quite a bit of money on a amount of money that can accumulate. I know that in other states, I think there's a lot of, Maine's not the only one, and they might have changed theirs, or I don't know if it's even still the law in Maine, but Texas has something similar, New Jersey does. There's a lot of different states that do something different than this deferral process. I know that with housing and that stress and that cost and the housing expenses, this seems, and it's a very narrow set of the population, it seems like it's probably not doing enough to relieve pressure for seniors that are having those housing pressures. It doesn't seem effective necessarily. Some people are using it for sure. I know in some states it's portable. Your tax freeze is portable. If you've lived in let's say you downsize or move somewhere else and you have to lived in your property longer, 10 years or something, but it's portable. If there's a difference back to the municipality, the state fills that gap for the municipality. I think it's, I don't know, I think maybe talked about again, maybe it should be part of our legislative process we don't do this either, right? This is a state thing. We don't make this policy. It impacts us, of course, but we're not in the legislature, we're not the governor, so we're not state. But maybe it could be a reasonable policy going forward advocating for something like this on what we do in our government affairs work in the session. I think it would be, there's models that seem to work for other states that maybe we can look at that would help relieve some of that pressure on seniors. I'd be supportive of that, but I think we could do better than what we're doing currently.
Yeah, I think one of the comments I want to make is I agree with you wholeheartedly on this, and I think that one of the other alternatives I've seen is they cap their interest rate so it doesn't increase at 3%. So they're able, because they're on such a fixed budget. In other states I've seen where they've done that. I know there's been discussion with the legislature about that. And the other thing, that 500,000, so many elderly couples have a little nest egg and they use it for health care or in-home health care that they have to pay. And families can eat through that at a tremendous rate.
Yep.
And so I could see some real concern of, it sounds like a lot of money. I mean, I've heard costs just that are astronomical to have CNAs or other people come in and help take care of, their loved one, and they can really eat through a lot of money pretty quick. So on one hand, I like Commissioner Savas, 300 and some people. That number is, I was surprised how many people are using it. So, I mean, it is helping some folks. So I appreciate your presentation and getting us some clarification on some of the issues. So thank you. I know Commissioner Helm and Savas both have questions. I think it was Commissioner Savas.
Yeah. So one other question I have, I think it's referenced here a little bit, and that is I know that not all, but many of the manufactured mobile homes are taxed as the structure itself. Is that correct?
Yes.
Okay. So that would apply here as well?
Correct.
Okay. So just so people are aware, I know a number of people that own their trailer or their home, and it's on a leased property in a manufactured park or manufactured type park where that housing is legit. They pay whatever fees they have as well, and some of those are not really taxed very much because they're not worth anymore. They depreciated to the point to where there's not. I understand there's not a real high tax burden for a 1955 mobile home trailer, if you will, versus a newer one that might be 10 years old. But that said, what I wanted to share was that people do pay their lease on those properties, and those leases have gone up. It used to be that $300 to $400 for your spot, and now that's 5, 6, 7, 800 and more. So it's gone up. It's more than doubled. But so that's put a lot of pressure on people that, are, again, got in on a more affordable means of housing. And I do know the state is looking at trying to expand more mobile home parks, because in a lot of counties, there's not any more park land or property that is zoned to do that. But it is awfully affordable. But there again, you look at, I remember one time, Martha, you went on a tour with us.
Yep, I remember.
And
we
some of
looked
those
at-
homes are fantastic.
They're really nice.
Yeah, the way they build them now, 60-year warranty, and they're pretty impressive. They're just gorgeous. So it's an option for housing that a lot of people find affordable. So I'll just leave it there. Chair, I yield back.
Commissioner Hill.
Do you know, Bronson, the 376 tax accounts, do you know what dollars that translates to?
Yes. So 376 homesteads that are in the deferral program. This 25-26 tax year, $356,000 in taxes. And again, about $325,000 or 91% is for the senior portion of this program. And again, just so we get made whole on that. We're not losing any money from this program because
Right.
it's a deferral.
Can we get it back from the state?
Every year.
Yeah.
We get it
Okay.
back. They send us a check every year.
Okay. All right, thank you.
I just did some math, and if your staff later can email me back if I'm wrong, but I just did some math. I used your number and divided it by 376, and I got the number of $947,000 per account of savings annually. If that's wrong, then have your staff just email me.
That sounds right.
Yeah. That's good.
All right.
Well, again, that's a substantial relief of burden for people. So,
Is
thank
this
you.
on the website? And how is this available to people to know about?
Yes, we have on our website, we have a senior disabled deferral button that people can click on. And if we have a phone call or they come in or an email, we help them out to get them to the information. And you can also go on Oregon Department of Revenue's website in the Property Tax Division section and find the same information or similar information, and the application. The application will be the same.
All right.
So, Chair, do you think it's reasonable that we maybe suggest that maybe PGA through their CLACO could at least circulate this information, let people know that they potentially could qualify or whatnot?
I know some stuff's going on in that area, so I might let Gary answer that.
Sure, we can promote that. We always look to the elected official in charge to give us permission to do that. So do you have any objections to that, Bronson?
No objection if we can review the notification before it goes out for accuracy.
Yep, we'll work with the assessor and we can put that out. Yes, absolutely.
Great. Thank you for all your good work.
Yes.
Appreciate you coming forward today.
All right. Thanks. Thank you so much. Appreciate you coming in today. And Gary, anything else?
You have completed your policy sessions for today. That is all.
All right. Well, thanks for joining us this afternoon. As a reminder, we will not have a business meeting this Thursday, July 16th, due to a lack of a quorum. Our next business meeting will be Thursday, July 23rd. So with that, we'll be adjourned. Thank you.